Good morning, Professor Tan.
Good morning, Mrs. Kate.
We are so lucky to have you on the stage today, discussing an important health topic such as diabetes mellitus. So, Professor, what really is diabetes mellitus?
In simple terms, diabetes mellitus is the condition in which the body does not properly process food for use as energy. Most of the food we eat is turned into glucose or sugar for our bodies to use for energy. The pancreas, an organ that lies near the stomach, makes a hormone called insulin to help get the glucose into the cells of our bodies. When you have diabetes, your body either does not make enough insulin or can't use its own insulin as well as it should. This causes sugar to build up in your blood. This is why people refer to diabetes as sugar.
So what can you tell us about the various types of diabetes mellitus?
Type 1 diabetes mellitus, previously called insulin-dependent diabetes or juvenile-onset diabetes, may account for 5% to 10% of all diagnosed cases of diabetes. Risk factors are less well defined for type 1 diabetes than for type 2 diabetes, but autoimmune, genetic and environmental factors are involved in the development of this type of diabetes. Type 2 diabetes was previously called non-insulin-dependent diabetes mellitus or adult-onset diabetes. Type 2 diabetes may account for about 90% to 95% of all diagnosed cases of diabetes. Risk factors for type 2 diabetes include older age, obesity, family history of diabetes, prior history of gestational diabetes, impaired glucose tolerance, physical activity, and race. African Americans, Hispanics, Latin Americans, American Indians, and some Americans and Pacific Islanders are at particular high risk for type 2 diabetes. Gestational diabetes develops in 2% to 5% of all pregnancies, but usually disappears when a pregnancy is over. Gestational diabetes occurs more frequently in African Americans, Hispanics or Latin Americans, American Indians, and people with a family history of diabetes than in other groups. Obesity is also associated with higher risk. Women who have had gestational diabetes are at increased risk for later developing type 2 diabetes. In some studies, nearly 40% of women with a history of gestational diabetes develop diabetes in the future. Other specific types of diabetes results from specific genetic syndromes, surgery, drugs, malnutrition, infection, and other illnesses. Such types of diabetes may account for 1% to 2% of all diagnosed cases of diabetes.
So what are the symptoms of diabetes mellitus?
Those who have diabetes may have some of the following symptoms: frequent urination, excessive thirst, unexplained weight loss, extreme hunger, sudden vision changes, tingling or numbness in hands and feet, feeling very tired much of the time, very dry skin, sores that are slow to heal, more infections than usual. Nausea, vomiting, or stomach pains may accompany some of these symptoms in the abrupt onset of insulin-dependent diabetes, also called type 1 diabetes.
So what are the treatment for diabetes mellitus?
Treatment for type 1 diabetes mellitus involves 1. Taking insulin, 2. Carbohydrate, fat and protein counting, 3. Frequent blood sugar monitoring, 4. Eating healthy foods, 5. Exercising regularly and maintaining a healthy weight. The goal is to keep your blood sugar level as close to normal as possible to delay or prevent complications. Generally, the goal is to keep your daytime blood sugar levels before meals between 80 and 130 milligrams per deciliter, and your after meal numbers no higher than 180 milligrams per deciliter 2 hours after eating. Treatment for type 2 diabetes typically includes diet control, exercise, some blood glucose testing, and in some cases, oral medication and/or insulin. Approximately 40% of people with type 2 diabetes require insulin injections.
So can diabetes be prevented?
A number of studies have shown that regular physical activity can significantly reduce the risk of developing type 2 diabetes. Type 2 diabetes is also associated with obesity.
So are there any food recommendations for diabetic patients?
There are so many foods recommended for diabetic patients, and I will mention a few. 1. Fatty fish. Getting enough of these on a regular basis is especially important for people with diabetes, who have an increased risk for heart disease and stroke. 2. Leafy greens. Leafy green vegetables are extremely nutritious and low in calories. They are also very low in digestible carbs, or carbs absorbed by the body, so they won't significantly affect blood sugar levels. 3. Avocados. Avocados have less than 1 gram of sugar, few carbohydrates, high fiber content and healthy fats, so you don't have to worry about them raising your blood sugar levels. 4. Eggs. Eggs decrease inflammation, improve insulin sensitivity, increase your HDL, good cholesterol levels, and modify the size and shape of your LDL, bad cholesterol. 5. Beans. Beans are a type of legumes rich in B vitamins, beneficial minerals, calcium, potassium and magnesium, and fiber. 6. Nuts. Research on a variety of different nuts has shown that regular consumption may reduce inflammation and lower blood sugar, glycated hemoglobin and LDL, bad cholesterol levels. 7. Greek yogurt. Some research suggests that eating certain dairy products like yogurt may improve blood sugar management and reduce heart disease risk factors, perhaps partly due to the probiotics it contains.
Thank you very much, Professor Tan, for being with us today, discussing such an important disease condition.
Thanks to you too for inviting me.
To follow up on talk shows and case management of other disease conditions, please click on the subscribe button on the right and the like button on the left.